Welcome to the Health Service Excellence Awards 2021.
Hello from the boardroom in Dr. Stephen's Hospital. This year's Health Service Excellence Awards come during what has been an extraordinary time for the health service. Since March 2020, our staff have been challenged like never before as we sought to protect the public from COVID-19 and to treat those affected by the disease. Staff have responded with great resilience, dedication and commitment. They have innovated and changed as the pandemic progressed, and day in, day out, they have continued to provide the services needed by our public. Many staff are exhausted, but they should also be very, very proud of what they have done. This award ceremony celebrates just some of the great work. The cyber attack in May caused us to pause this virtual event, but we are delighted now to be able to host it today to ensure that we honour the finalists and announce the category winners who entered this year's awards. The Health Service Excellence Awards are now in their 5th year and are well established in the culture of the health service. Before we begin, we have a message from the Minister for Health, Stephen Donnelly.
Hi there, it's great to be able to talk to you today as we recognise the excellence across our health and social care services. The last year has been tough for everybody, not least of all for our health service staff who've stepped up and made huge efforts to protect us all and care for everyone right through the pandemic. I can't thank you enough for everything you've done as frontline workers, as support staff and those in management and in operational roles. And just when we were seeing real progress and we were all on the pathway out of this pandemic, the hideous cyber attack struck. And yet again, all of you have stepped up to the plate to keep the health service running. The last 15 months has tested everybody, but all of you have shown the innovation and the change that was needed to provide the services that our public so desperately needed to keep going. The HSE responded quickly to the COVID crisis, from public health to testing and tracing and vaccinations and so much more, and you did all of that. When it mattered most, you redeployed to the jobs we needed you to do, and we also recruited more staff to serve the needs of the public. So today is about recognising all of that work and the role that each of you has played in it. I'm hugely impressed by the level and calibre of the entries for this year's Health Service Excellence Awards, and importantly, the fact that all parts of the health service are represented, the hospital groups, the community health organisations, the Section 38 and Section 39 agencies. 2021 sees an unprecedented increase in health service funding, and the National Service Plan sets out health and social services being provided to the public. Between the incredible work you've done and the increases in staffing and other capacities like community networks that are going to be possible, we really are taking important steps towards universal healthcare, which is our goal. In my role as Minister, I encourage and applaud our health service staff for your commitment and ask all health service staff to continue to work together to accelerate the impact in making our services better and better. To all the projects and to the finalists in this year's awards, I congratulate you. You can take huge pride in your work and the work of your teams and in your health service story. Thanks again and have a great day.
Thank you very much to Minister Donnelly. And now I'd like to introduce a message from the Taoiseach, Micheál Martin.
I'm always happy to be asked to address the Health Service Excellence Awards, but this year in particular, it is a privilege. First things first, let me congratulate not only all the category winners, but also the projects that have been commended. We are slowly emerging from one of the toughest years our country has experienced, one in which the health services were at the front line. I'm sure I don't need to tell you about how difficult this past year has been, but I would like to say to you how grateful I am, how grateful the entire country is, for the leadership, commitment, resilience and adaptability demonstrated by health service staff in addressing the needs of patients every year, but specifically over the COVID period. You have my admiration and respect, and the admiration and respect of the government. The innovation and ambition demonstrated by the projects submitted to these awards are emblematic of the quality of service you provide. Your response to the COVID pandemic, and more recently in managing operations through the criminal cyber attack on health service IT systems, illustrates further your commitment and flexibility. Last year, we witnessed unprecedented levels of interagency collaboration as the health service embraced an all-island approach to the COVID response. Local leadership, supported by national direction, enabled the setting up of Test and Trace and the rollout of the vaccination programme. This collaborative approach is evident in the projects submitted for the awards. They demonstrate the HSE's values of care, compassion, trust and learning. The 651 entries received are characterised by your ambition to make things better for all. Congratulations to the category winners and to all who entered, to the line managers, sponsors and selection panels. Each of you should be proud of your work. It has been a long year, thanks in no small way to your efforts. We are now finally opening up the country again, and I know all health service staff will continue with your collective endeavours as we reopen our health services.
And now, here is a short message from the Chair of the HSE, Mr. Kieran Devan.
Thank you and congratulations. Thank you for the ideas and the innovations and the improvements that you have demonstrated. Because it's those skills which will allow us to embrace the reforms, whether they're articulated in Sláinte Care, whether they're in Healthier Ireland or the HSE corporate plan. There are two things which struck me about the entries this year. The first is the degree to which they rely on collaboration. Collaboration within teams, collaboration between teams and indeed between organisations. And the second is the degree to which the values of the HSE came through and that passion that the people of the HSE have for providing the best possible care in the most effective way. The past 12 months has shown us the resilience of our staff, and it's also managed to show the public what perhaps was unseen for many years, the brilliance that takes place every single day in every single part of the HSE. So thank you for everything you have done. Congratulations to everyone who entered and to all the winners. Cogordiachas, Muile Burchas, agus Buntana Vasanike.
We're delighted to be joined today by the HSE CEO, Paul Reid.
I'm delighted to have the opportunity today to express my admiration and gratitude for the extraordinary work done by our staff and to acknowledge your contribution to the annual HSE Excellence Awards. I am informed that a record number of entries were received this year, with just over 700 teams entering projects, with 80 staff members being nominated for their outstanding contribution. The past few years have been extremely difficult for everybody. The pandemic has stretched resilience in all areas of our lives, personal and professional. Nowhere, I think, is this more true than amongst our healthcare workers. Our pandemic response and our response to the cyber attack have proven to the government, to the public, but perhaps most importantly to ourselves, that we possess the ability to confront and respond rapidly and effectively to evolving and complex issues in healthcare. Over the past year or two, we have showcased the impressive skills that we have and can-do attitude in all our areas of work. It's my hope, as your CEO, to ensure that we are careful to nurture and maintain that culture of commitment to excellence that has taken hold in this organisation. We must do this by taking care of our staff and of one another, by supporting leadership development within the clinical community and by continuing to invest in your ideas. I'm truly impressed by the quality of the entries received this year, and it's clear that patients are already reaping the benefits of your efforts to prioritise and improve patient care. This is what the health services is all about. Once again, congratulations to you all. I applaud the leadership that you have each had shown within your respective fields, and I hope to express my appreciation to many of you in person once the circumstances permit.
Now, as we begin the awards event, I would like to acknowledge the local coordinators who completed the first shortlisting of applications and the selection panels who were faced with the difficult task of choosing the finalists for the 2021 Health Service Excellence Awards. While the awards ceremony may be different this year, the rigorous judging process by our panel of experts and peers has remained the very same. I would like to say a thank you to all of those involved in this two-step process and to acknowledge the commitment of the judges. Now, down to business. Our first category is Excellence in Quality Care, and our panels have identified 10 finalists for this award.
And the nominees are St Luke's Hospital, Kilkenny, GEMS Home First Pilot, Integrated Frailty Care Kilkenny, Dublin North City and County Child CAMS. What matters to you matters to us, a quality initiative to enhance the voice of the child in CAMS. Naas General Hospital, NGH, OT Triage Assessment improves diagnosis, treatment efficiency for geriatric patients. Mater Hospital and CH09, Community Health Network, StrokeLink. Jigsaw, Jigsaw Live Chat Service. Irish National Gestational Trophoblastic Disease Centre. Establishment of the Irish National Gestational Trophoblastic Disease Centre. Cork University Hospital, Colorectal Surgery Optimise Prehabilitation Programme. Trauma Ward, University Hospital Limerick. ACDC, Accelerated Community Discharge Care Plan for Hip Fracture Patients. University Hospital Limerick. Novel use of CT coronary angiography enables accurate diagnosis in ED. University Hospital Limerick. Virtual visiting, connecting patients to their families using video technology.
And to announce the winner in this, we are joined by Anne-Marie Hoey, the HSE National Director of HR.
Thanks, Mark. I'm particularly proud of the staff of the HSE and indeed all health service staff for their enduring commitment to our response to the COVID crisis. National HR recognises the need for the organisation to empower staff to be resilient, to take leadership roles and to deal with the pressure of constant change. And this year has seen all health service staff rise to this challenge, changing roles rapidly and working to the top of their clinical and non-clinical roles. This year's awards showcase the initiatives that are taking place in our services, and along with my HR colleagues, we are very conscious of the need to maintain the new ways of working that have been demonstrated during the COVID-19 response. And therefore, I am pleased to announce that this year's winner in the Excellence in Quality Care category is from Cork University Hospital. The project is the establishment of the Irish National Gestational Trophoblastic Disease Centre.
Thanks to Anne-Marie for joining us, and let's hear about this project.
In this disease, a malignancy can occur in the placenta, which requires multiple courses of chemotherapy for cure in many women. Over many years in Ireland, the management of gestational trophoblastic disease and molar pregnancy has been quite inconsistent, and many patients have had to travel to the UK for treatment. And with the help of the National Cancer Control Programme and the Health Service Executive, we set up a National Gestational Trophoblastic Disease Centre here in Ireland to provide excellence in care for all women diagnosed with molar pregnancy in Ireland. Since going live in 2017, we have now managed over 500 women in Ireland with gestational trophoblastic disease and molar pregnancy, with 100% success rate. Many of these women have required multiple courses of chemotherapy, but all have been cured, thankfully. Most patients give us feedback that as well as receiving professional and expert medical care, they also feel minded by our nurse specialists. To me, this peace of mind that the patients have while being medically managed on this dangerous journey means that the establishment of our national centre has been a success.
So congratulations to Dr. John Coulter and his team for being so deservedly recognised for this innovative project. Our second category is innovation in service delivery. Throughout the pandemic, of necessity, we have seen daily service innovations. It is no surprise that we had 118 entries in this category, and the selection panels have identified 12 finalists.
And the nominees are Community Healthcare East Primary Care, pilot consultant-led multidisciplinary community-based diabetes clinic in County Wicklow, St Vincent's University Hospital, National Ambulance Service, St Columkille's Hospital, Emergency Department in the Home. Peamount Healthcare, from strategy to action, Peamount's Level 2 Neurorehabilitation Service. Grange Gorman Primary Care Centre, Community Paediatric Ophthalmology Waiting List Initiative, HBS Business Excellence and Digital Innovation, and HBS Procurement. Leveraging Lean to enhance clinical value-add activities in a theatre setting. Naas General Hospital. Multidisciplinary IBS pathway improves patient care and reduces endoscopy demand. St. Luke's Radiation Oncology Network, SLRON, at Beaumont. Introduction of prostate stereotactic ablative radiotherapy, SABR. Irish Association of Heart Failure Nurses on behalf of 34 HF centres across Ireland. Innovation through collaboration. Implementing heart failure remote monitoring during COVID-19. Occupational Therapy Department, St. Finbarr's Rehabilitation Hospital, Cork. Evidence-based upper limb rehabilitation using novel virtual technology and patient-led therapy toolkit. Orthopaedic Department, University Hospital, Waterford, UHW. UHW Fast Track Knee Pathway. Nina General Hospital and Croom Orthopaedic Hospital. Virtual triage of ULHG spinal orthopaedic waiting list. Acute Medical Unit, Galway University Hospital. Smoothing GP referrals to AMU using HealthLink.
Dean Sullivan, Chief Strategy Officer, is here today to announce the category winner for Innovation in Service Delivery.
Thank you, Mark. I'm delighted to welcome you all today to announce the category winner in Innovation in Service Delivery. I would like to thank and acknowledge the work of all of our entrants for these Health Service Excellence Awards. The past year has been one of the most difficult in the history of the health service in Ireland. However, it has led to new ways of working and new ways of thinking how we will deliver our health service into the future. We have seen the value of relationships coming to the fore in getting things done. Local managers and their teams have worked in partnership with local organisations and communities to mobilise action. We have seen where multidisciplinary teams have become more cohesive and have worked outside of their traditional boundaries. As an organisation, we're always seeking in the HSE innovative thinking and cross-boundary working between community and voluntary organisations. We will build on what we've managed to achieve in the past year and continue to encourage cross-collaboration as the health service moves forward. I'm pleased to announce that the winner in this very important category is the Community Paediatric Ophthalmology Waiting List Initiative in Grangegorman Primary Care Centre in CH09. Very well done to everybody involved.
Thanks, Dean. And now to hear about this project from the category winner, Dr. Duncan Rogers.
Hello, my name is Dr. Duncan Rogers. I'm the consultant lead for the Grangegorman Community Ophthalmology Service. We are situated in Dublin North City and County in CH09. The name of our project is the Grangegorman Ophthalmology Waiting List Initiative. And the reason that we took up this initiative is over the last 5 years, the Grangegorman service had a waiting list of between 2,500 and 3,500 children, waiting on average 18 months. This was a real issue as within the context of children's vision, we have around a 2-year period where we can intervene and stop blindness. So an 18-month average wait was something that we couldn't continue with. The initiative itself was in essence a secondary rescreen of the entire waiting list and was only made possible by previous work done by the team I'd come into, integration with the Directors of Public Health Nursing and the full support of management within CH09. And at that point it was Tom Flynn, Director of Primary Care Services, Michelle Ford, the General Manager, Annette Murphy, Area Manager, and her assistant Kathleen Eccles. The impact of this was that we saw 2,782 children over a 3-week period, and I'm delighted to say that 1 year on, we still do not have a waiting list. And this means that referrals are seen within 6 weeks if they're urgent and 12 weeks if they're routine. The amount of clinical time that has been released from the lack of waiting list has allowed us to now run, to my knowledge, the only additional needs children's ophthalmology clinic in the community in Ireland. And furthermore, we have been able to train our optometrists and orthoptists into expanded roles, which is going to be helping our tertiary services by removing some of the burden of care they currently have. Thank you for your time and attention.
Congratulations to Duncan and to the team in Grangegorman, and congratulations also on the waiting list initiative. Our next category is improving patient experience. We got 104 entries in this category, and the selection panels have put forward 12 projects as finalists.
And the nominees are Lisdarn Unit, Service Without Walls, Getting You Home Project, Central Remedial Clinic, Mobile Technical and Therapy Teams, Delivering Assistive Technology at Home, National ICT Project, National Deployment of Attend Anywhere Video-Enabled Care, Ear, Nose and Throat ENT Department at Children's Health Ireland, CHI at Temple Street. The introduction of paediatric day case tonsillectomy in CHI. National Maternity Hospital, supporting bereaved parents during the COVID-19 pandemic. St Luke's General Hospital, Carlow Kilkenny. Traveller Health Working Group, St Luke's General Hospital, Carlow Kilkenny. Beaumont Hospital, reducing the wait, the Neurosurgical OPD Access Improvement Project. Pre-hospital collaboration between National Ambulance Service and Beaumont Hospital Physio and Occupational Therapy Departments. Pathfinder, alternative to emergency department for low acuity older 999 or 112 callers. The Heart Failure Service, University Hospital Waterford, keeping with the rhythm. University Hospital Waterford, Home First. Occupational therapy and physiotherapy-led supported discharge. Cork University Hospital. Advanced Nurse Practitioner-led Acute Oncology Service, Cork University Hospital. Galway University Hospital. Critical Care Units. ICU Family Link. Keeping ICU patients and families connected during visitor restrictions.
The Improving Patient Experience Award will be announced by the Chair of the HSE's People and Culture Committee, Yvonne Traynor, who is also part of one of this year's selection panels. Over to you, Yvonne.
Thank you, Mark. It has been a pleasure this year for me to be a member of one of the selection panels for the 2021 Health Service Excellence Awards. Not only a pleasure, but indeed a difficult task, given the very high standard of the entries received. As a member of the board and chair of the People and Culture Committee, our role is to support and encourage our people and to challenge the HSE to become a high-performing organisation. This in turn leads to improved patient experience and enables our teams to deliver to the very best of their abilities. The entries this year all reflected a genuinely innovative approach and demonstrated clear evidence of significant work. All of the projects showed collaboration with multiple stakeholders to effect real change. It is my pleasure to announce that the winner in the Improving Patient Experience category is Traveller Health Working Group, St Luke's General Hospital, Carlow, Kilkenny.
With thanks to Yvonne Traynor from the HSE board for joining us, and now to hear about this initiative.
Hi, my name is Paula and this is Zoe, and we're members of the Travelling Health Working Group from St Luke's General Hospital in Carlow, Kilkenny. The Traveller Health Working Group was the first of its kind in an acute hospital in the country, and it was established as a partnership approach between hospital management and staff, members of the travelling community, local traveller health projects, and the HSE South East Traveller Health Unit.
The aim of the group is to improve the patient experience of members of the travelling community who use the hospital services, and to provide the necessary training to staff to encourage them to work in a way that respects the cultural diversity of all service users.
This is a great project. Thanks to Paula and Zoe for that presentation, and congratulations to them on being winners in this category, and thanks to Yvonne Traynor. Now we're moving on to the Innovation in Digital Excellence Award, and here are the finalists in this category.
And the nominees are Community Assessment Hub Donegal, COVID-19 app, remote oxygen monitoring in the community setting, Cork University Hospital, VTAC, an augment to the reality of crowded clinics, Health Business Services, the Robotic Process Automation RPA Centre of Excellence, COE, Coombe Women and Infants University Hospital, a digital suite of antenatal education videos, Beaumont Hospital, smart triage of kidney transplant patients using remote monitoring, neuro-otology outpatients with integrated clinical specialist physiotherapist, digital rehabilitation during COVID-19, using a novel technology to deliver and improve care, Beaumont Information and Communications Technology Department and National Thrombectomy Service, Beaumont Hospital, National Thrombectomy Service, NTS, Database Development Project.
We are delighted to have Stephen Mulvaney, the Chief Financial Officer of the HSE, here to announce this year's award.
Thanks, Mark. It's always a pleasure to be involved with the Health Service Excellence Awards. Over the course of the pandemic, we have witnessed a rapid adoption of technology and the increase in telemedicine and e-health solutions, including through virtual clinics and appointments, use of e-consult platforms and digital technologies. Staff have identified the benefits of new ways of working, new models of care have emerged and are being implemented at pace. The finalists in this category reflect how technology has assisted the COVID effort and also signpost the future directions of health service provision, consistent with the vision set out within Sláintecare. Amongst the priority areas post-COVID are continuing to expand our use of e-health and technology, and in particular ensuring the use of technology-enabled solutions that create better connectivity, information sharing and improve the effectiveness and efficiency of our processes for the benefit of service users and staff. And the winners in the Integrated Digital Excellence category are from Beaumont Hospital with their project Digital Rehabilitation during COVID-19 using a novel technology to deliver and improve care. Congratulations to Beaumont Hospital.
Thank you very much, Stephen. Innovation in digital excellence has a central place on the HSE agenda for the coming years. We now have some more information on this project.
Hi, my name is Deirdre Murray. I'm a clinical specialist physiotherapist in Beaumont Hospital. I see patients with dizziness and balance problems for vestibular rehabilitation. During COVID-19, we weren't able to see our patients for the regular review and for progression of exercises that they normally require. And so we collaborated with Dr. Darren Meldrum from Trinity College Dublin, who had been working on Vertigenius.
So Vertigenius is a medical device combining with software to deliver vestibular rehabilitation remotely. So when you have a vestibular problem, you don't like moving your head because it makes you feel dizzy, anxious and fearful. So what we do is we try and get patients moving their head again. So we've developed a sensor that can track the head movement during exercises, and we can also track symptoms. The sensor talks to an app which a patient downloads from the App Store, and in the app they get their exercise program, they can see how to do it, and it also tracks what they're doing through the head sensor. All this information gets fed back into Beaumont Hospital into a clinician portal, which is GDPR compliant and very secure, and the therapist can then see how the patient is doing and remotely prescribe a changed exercise program if necessary. So it's really cutting down the amount of time that a patient has to come to hospital, which is really valuable during the COVID times, but also saving the patient time and also saving the therapist time. There's no more looking for pieces of paper, they can just at the press of a button see how the patient is doing and send their patient exercises.
So Vertigenius was really useful for these patients during COVID-19, and we hope that we'll be able to use this technology going forwards to improve the efficiency of the care that we provide for these patients with vestibular issues.
And congratulations to Dr. Deirdre and the team in Beaumont working on this project. Our next category is supporting a healthy community. And here are the finalists this year.
And the nominees are Turner's Cross Daycare Centre, supporting older adults to stay physically active during COVID-19 cocooning and beyond. Adult Mental Health Kildare West Wicklow, Minding Me, supporting expectant and new mothers in Kildare West Wicklow. HSE Communications, Dementia. Understand Together, innovative collaboration to support people with dementia during COVID-19. St. James's Hospital, acute teaching hospital engagement with local schools. Beaumont Hospital, Beaumont Hospital Stress First Aid Initiative in response to COVID-19.
Our National Director of Community Operations, Yvonne O'Neill, is joining us today to announce the winner in this category.
Supporting a healthy community is fundamental to the Sláintecare values, and I'm very pleased to have been asked to announce the award in this category. The Supporting a Healthy Community Award is for initiatives undertaken by healthcare staff that demonstrate a real and positive influence on the health of a community. As the vaccination programme starts to make a real difference, the innovation shown by the project finalists will be very impactful for service delivery. The Supporting a Healthy Community Award in 2021 goes to supporting older adults to stay physically active during COVID-19, cocooning and beyond, from Turner's Cross Daycare Centre in Cork.
And thanks very much to Yvonne for joining us today. And now to hear more about this very special project.
The aim of this project was to assist our older adults at this time to remain strong and steady on their feet and so reduce their falls risk. We implemented this by creating an evidence-based exercise resource, which we also supported with an exercise video. Once cocooning finished, we put in place a walking programme in the local community hall.
We reached out to the older adults and agencies in our community to empower this project so that it would reach as many older adults as possible as quickly as we could. Our community partners were integral in the fast response and in its success.
The impact of this project is still ongoing, but what we do know, 200,000 copies of the exercise programme was distributed, 420,000 people were able to access this through national TV, 500,000 were also able to access this through YouTube, and the participants improved through balance, well-being, confidence and overall walking ability.
The partners were Creative Concepts, a volunteer private sector marketing agency, Cork Healthy Cities, Cork Age Friendly Programme, Cork Sports Partnership, the Irish Society of Chartered Physiotherapists, Ballyfan Community Development and Meals on Wheels.
One of the lasting impacts of this project are the newly fostered connections with other agencies in our community, working all together synergistically with a common goal to support older adults to stay strong and steady on their feet. We are delighted to reach the final of this award. Yay!
Congratulations to Michelle McNamara and all in Turner's Cross. We have created 2 new categories this year arising from innovations during the pandemic in the way we deliver services. A huge number of entries was received under these 2 categories, reflective of the innovation, agility and responsiveness of healthcare staff to the changing circumstances. The first of these new categories is operational services integration in a COVID environment.
And the nominees are COVID community testing, COVID operations, COVID community testing integration with the National Ambulance Service and Defence Forces, Corporate Estates Office, real-time dashboard monitoring solution for hospital oxygen supply and capacity, national programme with centres in Dublin, Galway, Cork and Limerick, COVID-19 contact tracing centres, CTC, nationwide, Health Protection Surveillance Centre, COVID-19 epidemiology team, S39 agency, COVID community assessment hub for vulnerable groups, St Vincent's Healthcare Group, St Vincent's Healthcare Group Strategic Skin Cancer Network, HSE National Social Inclusion Office, Community Strategy and Planning, coordination of COVID response for vulnerable groups, University Hospital Waterford, implementation of the largest outpatient virtual fracture clinic in Ireland.
And to announce this award, we are joined today by a very familiar figure. Colm Henry advised and reassured the population over the past 18 months, and we're delighted that he's with us here today. Over to you, Colm.
Thank you, Mark. I'm especially pleased to be announcing the winner in this category, as I've witnessed personally how healthcare staff, in the middle of a pandemic that none of them had ever experienced, managed to come up with new ideas and bring them to reality, while at the same time delivering services in the most difficult and trying of circumstances. During COVID, we all learned how to adapt and change the way we worked. Some of our staff were redeployed, some were involved in setting up new services such as testing, contact tracing and of course vaccinations. We all learned to work in a more blended way. All stepped up to the mark. I'm really proud to be working with these colleagues right across the country. The finalists in this category demonstrate the range of initiatives and innovations that occurred over a really short time span to keep our services running and to support the new services which were essential. And the winner in the operational services integration in the COVID environment category is the COVID community testing integration with the National Ambulance Service and Defence Forces.
With thanks to Colm for joining us, and now to give us more information on this project, we have a short video.
We are the National Community Testing Team comprising the 9 CHO community testing leads, the National Ambulance Services and our partners from the Defence Forces. The title of our project is COVID Community Testing Integration with the National Ambulance Service and our Defence Forces. The project was set up to monitor the COVID testing demand across the country. Meeting 3 times a week, our team evaluates the data and makes decisions in a timely manner with regard to where we will deploy additional resources to support our testing across the country. Overall, this team supports the national COVID-19 effort by ensuring that we have the maximum capacity available and ensuring that tests are taken in the minimum amount of time.
Congrats to Ken Stanley, the Army and the Ambulance Services and the broader team, and thank you to Colm Henry for announcing the category winner. and for being a very, very visible face of the HSE throughout this pandemic. Next is the second category created to reflect the huge innovations that took place in response to the COVID pandemic. This category is called Service Development and Innovation in Response to COVID, and there were 187 entries. Given the rapid evolution of projects during this time and the huge variety of innovations, the selection panel have put forward 16 finalists in this area.
And the nominees are Children's Disability Services Sligo Leitrim, Emergency Out-of-Home Support for Children during COVID-19 Pandemic, Mayo Recovery College, Delivery of Online Recovery Education Modules, CADS, Community Alcohol and Drug Services, Midlands Louth Meath Area, CADS, Community Alcohol and Drug Service, Virtual Opiate Substitution Programme Clinics, Community Testing, COVID Operations, Setup of COVID-19 Testing in the Community, Clinical Design and Innovation, Office of CCO and HSE Research and Evidence, incorporating National Health Library and Knowledge Service, Research and Development and Health Intelligence Unit. Equipping the clinical community with easily accessible COVID-19 clinical guidance at point of care. Corporate Estates Office. COVID-19 Care, Step-Down Facility, City West Dublin and UL Limerick. General Practice. Link Workers, supporting care coordination for people with multimorbidity in primary care. Contact Management Programme. A pandemic response. The establishment of a contact management programme. COVID testing and tracing. COVID Tracker app. HSE Health Protection Surveillance Centre. COVID-19 Surveillance Robot Project. Rehab. People with disabilities supplying PPE to frontline workers. Mater University Hospital Dublin. Next Generation Healthcare Communication. National Women and Infants Health Programme. Maternal and Newborn Clinical Management System. Laboratory Developments. SARS-CoV-2. COVID-19. Public Health and Social Inclusion. COVID Cluster Rapid Response among vulnerable groups in congregated accommodation. University Hospital Limerick. Accommodation of a paediatric diabetes service to the COVID pandemic. Department of Anesthesiology, Sligo Hospital. PrEP 19.
And to announce the winner in this very well subscribed category, we are joined by Anne O'Connor, Chief Operations Officer in the HSE.
Thanks, Mark. The largest number of entries in this year's awards came under this category, and this is reflective of a year that has demanded so much of health service staff. Throughout the health services, staff have designed innovative ways of delivering care while keeping staff and patients as safe as possible. Staff have also developed ways to support the psychological well-being and mental health of both patients and colleagues. We have witnessed the embracing of new technology by all staff to respond to the needs presented by the COVID response. All of our services across acute and community settings have been challenged in ways never before experienced. The innovation and development that has taken place in the past year is reflected in the range of projects in this category, and the finalists demonstrate a broad reach into health and social services. The winner in this category is a pandemic response, the establishment of a contact management programme.
Thank you very much to Anne, and warm congratulations to the team involved. Now let's hear more about this project, and we're joined by Dr. Sarah Doyle.
Hi, I'm Dr. Sarah Doyle. I'm a specialist in public health medicine, and from March 2020 to March 2021, I was clinical lead of the HSE Contact Management Programme. Our project is entitled A Pandemic Response, the Establishment of a Contact Management Programme. Why we needed to establish the Contact Management Programme was in response to the COVID-19 pandemic, in the knowledge of the very large numbers of cases and close contacts that would soon be coming our way in Ireland. And the idea was to provide contact tracing of high volume but low complexity cases and contacts so that departments of public health could use their expertise to manage high complex settings and outbreaks. The impact of our contact management program, I believe, was in the saving of thousands of lives. And it did this by breaking individual chains of transmission through advice to cases and close contacts, and also through enabling departments of public health to manage large and complex outbreaks, and also do contact tracing in complex and highly vulnerable settings. A secondary impact was the impact it had on those of us who worked in the contact management program, the team working, and what it showed us is how, as working as a team, we could respond so effectively and efficiently to a crisis of this magnitude.
Congratulations to Dr. Sarah and to all the team in Public Health. Our last award goes to staff nominated by their peers under the Exceeding Expectations Outstanding Employee Award. This year, this category received an unprecedented number of nominations for colleagues, and we're delighted to be joined today by the HSE's CEO, Paul Reid, who will announce the winners in this category.
Thank you, Mark. I particularly enjoy partaking in the Health Service Excellence Awards, as it is a great opportunity for me to learn of the innovative work our colleagues throughout the health service are undertaking. The foundation of any great team are those members of the team whose dedication, loyalty and support for the service shines through and touches not only their peers, but the patients and the people that use our services. The last 18 months have demanded a lot from health service staff, and I am meeting on a daily basis staff who are going above and beyond the call of duty to serve our patients and to make things better for all. I'm very pleased that the awards have received so many nominations in this category this year. In recognition of the outstanding performance, professionalism and support, the nominations identify colleagues who utilise unique and innovative approaches to health service delivery in their area of work and effectively collaborate with all. This year, in order to recognise our outstanding colleagues, the selection panel have identified 10 winners in this category. In no particular order, the winners are
Anne Clerkin, Radiology Department Radiology Services Manager. Dr. Avril Byrne, Connolly Hospital, Blanchardstown, Consultant Geriatrician. Dr. John Connaughton, Midland Regional Hospital, Portlaoise, Clinical Director. Lorraine Kelly, Adult Mental Health Services Project Manager, Housing Coordinator. Magella O'Donnell, ICTOP Sligo, CNS Dementia. Mr. Terry Boyle and Breast Care Team, St. James's Hospital, St. James Surgeon. Vania Ndoma Egba, Primary Care Centre, Balbriggan, Paediatric Physiotherapist. Yvonne Doheny, Kilkenny Mental Health Service, Clinical Nurse Manager 3. Maria Lynch, Rheumatology Department, Our Lady's Hospital, Manorhamilton, County Leitrim, Clinical Nurse Manager 2. Morris Maloney, CAMS, Clinical Nurse Manager 2.
The selection panel have decided to award certificates of distinction to the HSE Public Health Department, the National Ambulance Service and the Occupational Health and Employee Assistance Programmes of the HSE.
Thanks, Paul, and congratulations to those departments on their awards. It is customary now to congratulate all the finalists and the winners in this year's awards, and of course we do so with great enthusiasm. But in a way, the winners are just representatives of tens of thousands of staff around the country and around the health service who have served their communities and their fellow citizens with quiet distinction and relentless commitment over this past 18 months. Each of the finalists will be presented with a certificate of achievement, and the winners will also be presented with one of these trophies. I would also like to ask each of you to complete the staff survey, which is live for the month of September 2021. We are asking that all health services staff complete this survey so that we can learn from you and improve things for the staff in the future. Details of the staff survey are available on hse.ie/staff survey. So thanks to everyone for watching. Congratulations to everyone for the work you have done and the work that you do every day. Take care.